Now, of course, the aim of the plan is to ease pressure on GPs and hospitals. Do you believe that it will have that effect?
So trying to explode that myth a little bit with GPs, what we've seen in the UK is it's actually increased delayed presentations and misdiagnosis. So we need to make sure that people do what they're best at doing and what they're trained for. And, this has been done to address access. We know that Maccas is easy access, but it's not necessarily healthy for you. So it's a bit of a false economy. And we need to make sure that we invest in the system from the bottom up, not just keep, shifting the deck chairs around.
Yeah, so just to go into that more, what changes do you think that we need to see to address these pressures on GPs and hospitals?
So with respect to access, the ABS data actually says that 4 out of 5 people can get into their GP within that first 24 hours if they need to. And we need to make sure that we invest in the foundations of the healthcare system, and that is general practice and primary care. And we know that the funding in that has been dropping and more has been going into hospitals. So that's our call to the government: invest more in general practice and primary care, keep people well and keep people out of hospital.
And I guess what's your message to patients, to people who might be thinking of going to see a pharmacist to get treated for one of these conditions when this comes into effect?
Look, 9 out of 10 people see their GP every year. If you've got something that you're concerned about, touch base with your practice and your GP, and keep seeing your pharmacist for your medicines. That's what we're trained for, and we work very, very closely together. However, we can't start fragmenting care and splitting the system off. We need to make sure that we have continuity and we work together.
Thank you very much for joining me. That's Dr. Nicole Higgins, who is President of the Royal Australian College of General Practitioners.